If somebody got tennis elbow from a sport activity, do they need to stop participating in that sport?
That's a big one because they never want to stop. My name's Rebecca Petrosino. I'm a physical therapist and I'm board certified in orthopedics. Tennis elbow, or lateral epicondylitis, is an inflammation of the tendon where it attaches to the bone on the outside of your elbow. This can frequently be aggravated with playing tennis, pickle, paddle, or just repetitive gripping activities. The symptoms of tennis elbow include pain with gripping and with rotation of the arm in an outward direction. The typical terminology of tendinitis in regards to tennis elbow can actually sometimes be a tendinosis. The difference is that tendinitis is an acute strain where you just injured your elbow within a week to 10 days ago, and it is irritated, tender to touch, and painful. Tendinosis is where this has been a chronic issue for months or even years with repetitive overuse. If you're experiencing acute or new injury involving your elbow, you may need to rest from your sport or wear a splint for support in order to return to activity. Your physical therapist will assess you for tennis elbow by looking at your grip strength and your ability to resist wrist extension. Exercises that can help improve tennis elbow include wrist strengthening in flexion and extension, as well as elbow strengthening in the biceps, triceps, supination, and pronation. If you're experiencing pain in your elbow with gripping, lifting, or moving your arm to the outside of your body, you may have tennis elbow and would benefit from screening with your physical therapist.